Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us is Tyler Shandro, the Minister of Health, and Dr. Dina Hinshaw, Chief Medical Officer of Health for Alberta. Minister Shandro will provide brief opening remarks, and then Dr. Hinshaw will provide her usual update.
Well, thank you, Tom. In March, when we were faced with the beginning of an unprecedented global pandemic, our government took a number of critical steps to protect Albertans from COVID-19. One of these measures was to help physicians provide virtual care by introducing new billing codes. Albertans could, with these new codes, access the care that they needed without risking being exposed to COVID-19. And it helped doctors and clinics as safe as possible. Virtual care gave physicians the flexibility to decide on the best way to provide care during the challenging times. And we've seen a great uptake in virtual visits. Recognizing that, today I'm pleased to announce that we are making these codes permanent. Virtual codes will no longer be restricted only to a public health emergency. Physicians will continue to have virtual options to help them provide care, and Albertans will continue to speak to their doctor from the comfort of their own homes. These billing codes allow patient visits, consultations, and mental health services to be provided over the phone or through secure video conference. Now, to be clear, in-person care will continue. This is simply another option for Albertans and their physicians, and physicians will offer virtual services where appropriate. All existing rules and rates for these virtual codes will remain in place. They will also remain excluded from the daily patient visit cap. This will ensure that physicians can continue to provide the care to Albertans, the care that Albertans need while being fairly compensated. And this is an example of our government being responsive to the changing needs of Albertans. We'll keep on listening and making changes as we continue to respond to the pandemic to support patients and physicians through this pandemic and beyond. Thank you.
Thank you, Minister, and good afternoon. Today's numbers reflect the last 48 hours since we provided the last update on Saturday. I am pleased to report that 6,698 Albertans have recovered from COVID-19, leaving 355 active cases in the province. Currently, 44 people are hospitalized with COVID-19, with 6 of these in ICUs. Since Saturday's update, we have now surpassed the 300,000 mark for tests completed. Out of 11,025 new tests completed over the last 2 days, there were 64 new cases. We also have results for the asymptomatic testing we have been offering since May 12th. We will be providing this in a weekly update going forward. Since May 12th, of those we have tested with no symptoms, no known contact with a confirmed case of COVID, and no known connection with an outbreak, we have processed 14,853 tests, and of these, only 6 have been positive. In the last 48 hours, we have also confirmed 3 additional deaths in the province. This brings the total number of lives lost to 149. I extend my condolences to the family and friends of these individuals, as well as anyone grieving the loss of a loved one from any cause. Over the weekend, we were alerted to a number of cases linked with the Safina Foods processing facility in Edmonton. 6 cases have been confirmed, and all cases and close contacts are now isolating at home. With AHS's support, the facility has moved swiftly to implement all outbreak protocols. Site-wide employee testing is now being arranged, and we will continue to closely monitor the situation. These cases are part of a small jump in COVID numbers in Edmonton, some of which are related to ongoing spread from several social events where transmission happened over the past few weeks. With the slowdown in cases in Alberta, I know it has been tempting to believe that we can relax all precautions. Unfortunately, this is not the case. It is critical that all of us continue to take steps to protect our communities. This weekend, we saw many people participate in demonstrations to speak out against racism. I want to commend all those who wore masks and stayed 2 meters away from others while showing up to rally in support of this cause. The freedom to protest is a critical one, and yet we face a challenge in this time of pandemic to do so without risking super spreader events. I want to encourage all those who attended protests this weekend to go for COVID-19 testing whether or not you have symptoms. Contact tracing would be extremely difficult in large crowds such as this, so please also be mindful of your actions in the coming 2 weeks. Pay particular attention to staying 2 meters away from others and wearing a face mask if that is not possible. I have reached out to some of the organizing groups with an invitation to talk about how future protests might be able to be structured to reduce the chance of COVID transmission. As we start to see small increases in cases in some of our communities, we need to think creatively about how we hold space for voices that need to be heard, while not risking the low case counts that we have collectively worked so hard to achieve. Later this week, we will share details of our next step in Alberta's relaunch. As we prepare for this step, it is critical that we not lose sight of our collective goal, to allow further opening of society by continuing to work together to prevent spread. We have closely monitored our case numbers through Stage 1 to determine whether we needed to adjust our plans for Stage 2. I am happy to report that our rates of hospitalization and other metrics remain stable, and our daily cases, while fluctuating somewhat, are not currently showing a large spike. As of this morning, I have allowed both the Calgary Flames and Edmonton Oilers to resume practicing in their home arenas with public health measures in place. I look forward to sharing more details about Stage 2 of Alberta's relaunch later this week. I know many Albertans are looking forward to reopening and getting back to some sort of normalcy. The past few months have been difficult for all of us. This virus and the closure of many businesses has taken a toll. Many of us are worried about the virus and what it could mean for our health or the health of our loved ones. We are anxious about our livelihoods, how we're going to pay our bills, look after our families, and what's going to happen once this is all over. Physical distancing and other necessary measures have also made it challenging to connect with our friends and families, share our troubles, and find comfort in each other. The mental health of Albertans is something I am very concerned about. I have touched on this subject a number of times, and it continues to be important. We have all been affected by this pandemic. It's completely natural to feel overwhelmed, sad, or scared. You are not alone in feeling this way. We are starting to get information on some of the mental health issues emerging from this pandemic, and it is clear that this crisis has taken a toll. I know mental health can be a difficult topic to talk about. Reaching out can sometimes feel like the hardest thing to do, even with close friends or family members. As hard as it might seem, we need to talk openly and honestly about our issues and how they affect us. If you feel you have nowhere to turn, please reach out. Supports are available. The Mental Health Helpline and the Addiction Helpline run by Alberta Health Services have increased capacity to take calls. Their number is 1-877-303-2642, and you can find that number by Googling Mental Health Helpline Alberta Health Services. If you are in crisis or having thoughts of self-harm, please call 911. I also encourage you to be proactive and connect with your loved ones. Don't wait for them to reach out. Ask how they are doing and ask what you can do to offer support. The fallout from this pandemic will be felt for some time. Looking after our own and each other's mental health must be part of our new normal as much as regular hand washing and staying home when we are sick. I'd also like to encourage you to share your thoughts and experiences about your COVID experience through a confidential survey. The Health Quality Council of Alberta is inviting all Albertans over the age of 16 to take part in an online survey to better understand the holistic impacts of our response to COVID-19 and to determine where our health system can improve to meet your needs better as we continue to respond to this pandemic. Please visit www.hqca.ca to take the survey and share your experiences. Finally, I'd like to acknowledge that today is the start of National Blood Donor Week, a great time to consider donating. The need is constant for blood, stem cells, and plasma donors. If you're in good general health, please book by calling 1-888-2-donate or visiting blood.ca. Thank you for all you are doing to support others around you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first question, please?
First is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. You held a meeting with some ministers as well as members of the fitness business operator community last week. Are those businesses going to be folded into Stage 2, and why is it taking so long to make that decision, as we've been talking about for the last 2 or 3 weeks?
So we have heard from fitness operators, gyms and other fitness businesses about ways that they can open safely, and we've taken that information into account as we've considered Stage 2. And so there have been several discussions, as you mentioned, one with those operators. There have been discussions with the Emergency Management Cabinet Committee, and final decisions and communication about those will be coming very soon. We want to make sure that we're weighing the needs of Albertans to access services such as fitness services, which protect not just physical health but mental health, but at the same time making sure that we're thinking about the need to prevent spread of COVID. And so working through the details of what that looks like. But as I say, more information will be coming very soon.
Operator, can you put through the next question, please?
This is Laurent Perreault with Radio Canada. Go ahead, Laurent.
Hello. Earlier today, the WHO said that complacency is now the biggest threat in places where we have seen the spike of the epidemic. How big of a threat is it here, do you think?
So, I think we've seen some examples of pockets of spread where, again, people are feeling that the case numbers are low, we can get back to normal. And I think that, whether it's complacency or whether it's the natural human tendency to only focus on what's right in front of us, I think that's why we need to always be reminding people that this is not over, that the low numbers are a result of the work we've done together, that COVID has not gone away. And so we're doing our best, again, to remind all Albertans that we need to stay in this together, that the relaunch will be successful only if we can work together and make sure that we keep our numbers low. So absolutely, it's a concern. And again, continue to offer as many opportunities as possible for Albertans to see how when we start to relax and we don't take these measures, that it can unfortunately start to rebound and we may see our cases rising again.
Operator, can you put through the next question, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. How many cases can be linked back to those social events in Edmonton, and how many social events are you referring to? Are there any particular things that weren't done at those events that you believe contributed to the spread of the virus? And as for the outbreak at Sofina Foods, is asymptomatic testing being offered to employees there?
So with respect to the social events, there are 2 that I'm aware of where, again, distancing measures and mask wearing when distancing wasn't possible, that was not consistently applied. And again, I think it's quite natural to for people to start feeling like maybe they can ease up on these measures. We've all been waiting a long time to see our friends and family, and human connection is a critical and important part of all of our health. But we really do need to remember that it can only take one event where you could have one person who may be infectious and not even know it, and it can spread to 10 people, 20 people, depending on what the nature of that event is. And then what we're starting to see again is outward spread from the individuals who attended that social event. So again, it's not to point fingers at those particular individuals because they were the unlucky ones. I'm quite confident there were many other gatherings where people did not consistently follow distancing and masking, and these particular groups happened to be the ones where unfortunately the virus had made its way into that circle. And that's why all of us need to be so vigilant. And again, I want to commend those who did come forward for testing when they felt sick so that we could identify these groups of transmission and then do that further tracing. But because the incubation period of this virus, unfortunately, is so variable, sometimes by the time we identify that initial group of cases, there's already been secondary spread, and then we're racing to catch up. So again, want to really reinforce the need for consistent use of 2-meter distancing, masks when that's not possible, staying home when sick, getting tested when sick. And finally, you asked about Safina Foods. We are offering asymptomatic testing to all employees at that location at this point in time.
Operator, can you put through the next question, please?
Next is Lisa Johnson with Post Media. Go ahead, Lisa.
Hi, thanks for taking my question. Just to follow up on Julia's question, I'm wondering if you know what the numbers are related to those two events, and if we're still seeing those numbers kind of expand from those events, or if you could speak just about what the numbers are in Edmonton and what that indicates.
So the number of active cases in Edmonton right now has risen to 76. I don't have the specific numbers of all the layers of spread out from the events. The information that I have at this time is that one event had 10 cases, another had 8. And then from those two gatherings, again, it sort of that outward spread from those who attended and then went on, unfortunately, to expose others. Again, really wanting to reinforce that the good thing is that they've gone in for testing, they're now isolated, and that anyone who has participated in any event over the last couple of weeks where maybe they weren't strictly following the distancing or masking rules, it could have happened to them as well. So I think, again, this is not about judgment or pointing fingers. It's about reminding all of us we need to continually be thinking about how can we be sure that if I were the one to be exposed, it would stop with me. So first of all, I would try to prevent being exposed in the first place. But how can I make sure that in my actions, I'm not putting others at risk? So again, 2 meters distancing, masking when that's not possible. And if I feel sick, staying home, getting tested, making sure that we're following up on any of those contact chains so that we can stop the spread as soon as possible.
Small clarification, there are currently 92 active cases in the Edmonton zone.
Oh, sorry.
There are no more questions in the queue, so we'll wrap up there. Thank you all for joining us, and we will provide another update on Wednesday afternoon.